So my name is Harry Isles-Mann. I work sort of threefold. Fundamentally, I'm a patient and health consumer advocate and speaker. I'm also a committee member, and I run my own co-design and health consumer engagement consultancy as well. What drew me most, or at least sort of got me in the door, was that my background personally is that I've got more than 20 years of lived experience relying on our health system. So for me it was sort of naturally a progression of my own interest as far as what career that I wanted to pursue, and a bit of opportunity and good timing surrounding how my own lived experience sort of put me in a number of situations where I found myself in a position to influence the discussion on where we go next with things like healthcare. And the two of them ended up sort of weirdly being paired with one another, so that I'm now sort of operating more as a health consumer advocate with a more sort of a high level of technical understanding of our health system, but as someone that natively has also grown up relying on it extensively, which lends me sort of two unique sides of the same coin in providing some insight and value. So a couple of, or probably one of the sort of my most passionate involvements at the moment as far as project goes is I'm a consumer representative on the steering committee of the National Children's Digital Health Collaborative, which is designing and implementing effectively a perinatal, antenatal and paediatric version of the MyHealth record to try and coordinate and integrate care amongst sort of children and young people, but also sort of involve that maternal care aspect as well. One of the really important lessons I have learned from that is the value of embedding meaningful consumer engagement within various levels of governance, to ensure that as an organisation you're actually taking more than just token steps to involve the voice of health consumers and patients and end users of the systems that you design. It goes a long way to, during design, building trust, whilst working alongside them and ensuring that ultimately whatever you're designing and implementing meets actual needs, but also meets informed and valuable needs that consumers and patients demonstrate during that design process. Innovation is critical because we're really at a point where we are realising the value that things like data and personalised information can actually play. At the moment, like most things in health, the application is fairly reactionary. We're looking at ways we can bring the health system up to date, but for me the thing that really excites me is the future, where we are actually using health data and personalised health data to inform predictive and preventative health, and take a far more proactive approach to public health as an undertaking, to ensure that we are taking steps ahead of time to ensure that populations are appropriately equipped to deal with health challenges, instead of our health system operating in the same way that it has done pretty much since its inception, which is just to react to patients that come through the door and prescribe treatment as a reactionary measure, instead of actually getting ahead and putting in place some really good preventative steps. To me, one of the biggest, what I've experienced to be one of the most significant barriers in actually sort of implementing and integrating care has been that for the most part there still isn't necessarily a huge level of public or health consumer awareness or an importance that's placed on just how critical a role being proactive and innovative about confronting challenges in health can be, and how rewarding that could actually be for current and future populations. So in some senses we've got a system and advocates like myself who are recognising the immense opportunity to innovate and drive positive change, but the mandate to fund and explore and discover, which is for the most part, at least for our public health system, directed by government, isn't necessarily built on a great level of public awareness. So there isn't much of a mandate from government, from a policy or legislative side of things, or by demonstrating any kind of government leadership to really drive that innovation and take some risks where traditionally we haven't taken those risks before, because ultimately a driving force behind their decision making is whether or not it's an appealing or important notion to the public, whether it's something ultimately that matters to the public. So boosting that level of awareness and the importance and the value that we place on innovating in health, I think would go a long way to actually ensuring that we get a far more proactive, agile, not necessarily risky, but more forward-thinking and pragmatic approach to innovating in the space of healthcare. Absolutely. I think one of the things where we're only just now understanding is how even within health we're discussing notions of integrating care and breaking down barriers between silos, and that's a really, really great starting point. But even in different departmental involvement or aspects of society and community as a whole, the way things like social services and welfare overlaps with health, the way that those two overlap with our justice system, the way that the three of those then overlap with transport and infrastructure, we're starting to recognise now that things like health and education are actually woven into a far more complex tapestry that forms how we act and react as a national and as sort of a local community. So taking steps to ensure that our health system is actually plugging into a number of different areas, and that all these different areas across our communities are actually having a conversation with one another and communicating, I think is really going to open the door to a health system that is far more centred around notions of humanity and embedding trust, but also focuses on empowering individual agency and ensuring that people are equipped to make informed decisions in the right way at the right time, supported and empowered by appropriate types of care. Probably what I've enjoyed most about the event so far is for me personally, it's been very reassuring to see that there is a lot of overarching strategic thinking, attitudes to policy and care models and thinking in healthcare that is beginning to more properly recognise and reflect health consumer interests and more appropriately address concerns that patients and health consumers have, and that people are actually now taking steps to ask us as patients and health consumers what matters to us when we're seeking care and support from these services. So knowing that that's now a broader focus, for me as an advocate, is quite a comforting and reassuring thing that all these people are now recognising how valuable that perspective is.